Okay, good evening, everyone, and welcome to our Spring Care Member webinar. We appreciate the great participation for those who are joining us this evening. And as promised, we have some prizes that will be given out during the course of the webinar tonight. I'm going to start by introducing the team. Tammy Fiedler is with us, our Senior VP for Home and Community-Based Services. Derek Dunbar, our Senior VP for PACE. Jason, our Senior VP for Residential Services. Michael Fosina, who is the Chief Operating Officer at Calvary Hospital, and Chelsea Brock, who leads our learning and development team. So welcome, everyone. Let's go ahead to the agenda and we're going to pray first, then we're going to get to the agenda. Father Anderson had another commitment, so he couldn't be here with us this evening, but he wrote this, he put this prayer together for us tonight, and I'll be happy to read it and share it with the team. It's called Fall in Love. Nothing is more practical than finding God, than falling in love in a quiet, absolute, final way. What you are in love with, what seizes your imagination, will affect everything. It will decide what will get you out of bed in the morning, what you do with your evenings, how you spend your weekends, what you read, whom you know, and what breaks your heart, and what amazes you with joy and gratitude. Fall in love, stay in love, and it will decide everything. Amen. And I certainly want to wish a happy Passover for everyone who celebrated Passover this week. And now we have our agenda. Derek, why don't you walk us through the agenda?
All right. So first, Scott is going to give us an update, and which will include a Calvary update and a review of our system goals for this year, and also the latest and greatest on the state budget update, which just came through. And then Jason will talk about the Net Promoter Score, give an update on the latest on COVID, and he and Tammy will go through quality measures. And then Jason will wrap that up with hiring and staffing updates. And then Chelsea will bring it home with Great Place to Work.
And then we will open it up for questions, which is really the most important part of our webinar, is giving you the opportunity to ask us questions. So feel free, if you haven't submitted them in advance, to put your questions in the chat box, and we generally ensure that we get through all of them before we end the webinar. So Jermaine, who's at the controls this evening from the IT department, let's move right into the next slide, please. So I want to introduce virtually and in person Mike. Jeff Menkes is the interim president and CEO at Calvary Hospital. He joined us in early February, and Michael was hired shortly thereafter as the chief operating officer. Many of you know or may not know that Calvary has always been part of the ArchCare system since 2000 and I think April 2006 or 8. We've been the active parent or sponsor of Calvary, and the Archdiocese of New York has always been the sponsor of Calvary. So it's not anything new. It may seem like it's new because historically Calvary has operated a little bit more independently than the other programs within the ArchCare system, but it became clear the necessity for the success of Calvary's mission going forward, that it needed to take a more active role within the system. And Jeff was brought in to help with that transition, as well as Michael, and we're very happy to have them. I've been at Calvary a multitude of times since February and met with the team out there and the staff. Everyone has been extraordinarily welcoming, and we're really excited to have this closer relationship with the team at Calvary, and I know some of you are here on the webinar this evening. Michael, I don't know if you wanted to say a few words.
Yes, thanks, Scott. I'm excited to have joined ArchCare and Calvary and bringing a much closer, tighter working relationship. The advantages for Calvary of being a part of a bigger system is just what's going to help us into the future. So I'm excited about the opportunity of working with the executive team and working with all the staff at Calvary. So I'm looking forward to it. And thank you for having me.
Thanks, Michael. Jermaine? I thought I'd highlight the system goals. Our system goals are ones that are established that cut across all of the programs for the most part. They're different and distinct from the individual goals you might have within your programs. And the first is palliative care. We believe our focus on the holistic view of the people we serve and providing both spiritual and end of life care and palliative care is one of the things that sets us apart from some others providing similar services in the market. And in 2024, it's our goal to integrate palliative care into all of our care planning processes and care processes. We're fortunate that Calvary is one of the best at doing this, and they've been doing it for a number of years, and we plan on tapping their expertise in helping us to implement this. We are hiring a director of palliative care for the system. So if you know of someone who is interested and has that expertise, you should certainly send that, have them send the resume to us. We had a medical director of palliative care, Dr. Soraya, who unfortunately left to take a full-time faculty position at Cornell. So, we're hiring a new individual, and we look forward to rolling out our palliative care program in 2024. The second is remaining a certified great place to work. We're really proud of the fact that for 3 years in a row, you have voted through our surveys to get us certified as a great place to work. There's nothing more important than our engagement with our care members. It's through that engagement and your satisfaction at work and feeling as if you make a difference and that you're respected in the workplace and the work that you do that makes us successful. And we look forward to this year being the 4th year of achieving that. And Chelsea is going to be talking about that a little bit more at the end of the presentation. Next is our Net Promoter Scores. Jason's going to be speaking about those in a moment, but this is a way to measure for our customers to measure and provide us feedback on the services that we provide. And it links that feedback to various digital measurement tools like Google, etc. So we're really excited to have that up and running and to beginning to get those scores. The next is nursing turnover. The team at HR has been doing a great job on the recruitment side. We've made great progress on our staffing that you'll see before this presentation is over, but it's one thing to get new staff in the door, but we have to keep them, and we need to make sure that their experience is one that makes them want to stay and work at ArchCare. And so we're measuring our turnover and specifically benchmarking it against national turnover rates. And then lastly, Mitzi and the IT team are working with all the programs for business continuity plans in the event of interruption of our IT services due to either a cyber attack and or some type of disaster, and ensuring that we have a plan in place of how we would continue to serve our customers in the event of some untoward incident. So those are our key goals that we're going to be focused on. The state budget did pass this past week. I appreciate everyone's efforts with all the advocacy that we did with the leadership in Albany in attempting to close the Medicaid gap. It is definitely through those efforts that we were able to get a 4% increase in the Medicaid rate. The governor was proposing reductions in long-term care. Those reductions were mitigated with the exception of a reduction in the capital component of the Medicaid rate. So it was good work by everyone, and it paid off by getting this Medicaid rate increase. We were hoping to be able to offer the ability of our aides to pass certain medications and take the burden off of the RNs, but that did not pass, and we'll try that again next year. And just this week, the federal government implemented or passed regulations that over the next 2 to 5 years, depending on whether you're in an urban or rural area, you will be having these staffing mandates implemented, but they're very similar to the staffing mandates that we have here in New York. Next slide, Jermaine. And Jason, why don't you talk a little bit more about the Net Promoter Score, because we're out of the gate in a really good place.
Thanks, Scott. So this graph here shows you each of the nursing homes and where they stood with respect to their customer satisfaction rating for the 2 quarters leading in the fourth quarter of last year, the first quarter of this year, giving us data and giving us a baseline to see how we compare moving forward, and why it was important to get enough data from this current software, which is called NRC. And we wanted to ensure that we had a good baseline to improve upon, and where we actually stood. And as Scott mentioned earlier, from now on, when we take these surveys, the data will be pushed out to Google, A Place for Mom, Caring.com, and different platforms. And so our scores will be visible to the outside community and to our hospital partners, and they'll see real time, as we get comments, how we're doing inside the center. The current software, the data you see here is just for baseline purposes, so we can improve upon, because we only see this data right now. But starting May 1st, the data with the new software will show everyone how we're doing, and it's much simpler. The residents will have much easier time filling out the questionnaires. The questions are very clear, and we can change them should there be any confusion on a moment's notice. So far, 4 facilities have integrated with the new platform. Those 4 facilities are all but Edgar, TCC, and St. Vincent de Paul, who are coming online before the end of the month. And we're off to a good start. We're at 94% with those centers, so it's a good start. And we look forward to the rest of the year and improving upon our scores.
And PACE will be rolled into this. When are we projecting that?
We're in it, so we'll be putting them into the integration probably a month behind, but Christine's been working with PACE already to get them started.
And home care has its own patient satisfaction, and Calvary obviously uses Press Ganey. So we'll share those scores at the next meeting. I think it's time to give something away. Christine, could you look in the chat on the list of people participating and randomly pick a name and let us know what the name is and what they're going to win?
Okay.
Christine runs our marketing department, for those of you who don't know Christine.
Hi, everyone.
What are you giving away?
All right,
What
so
am I giving
today
away?
we are giving away a $50 Amazon gift card. So right now I'm gonna pick Natasha Ellie.
Well, congratulations, Natasha. And Christine will be in touch, and we'll be listing the winners on ArchCare 360 tomorrow. So congratulations on the $50 gift card. And Tammy, why don't you go through your customer satisfaction slide?
The home care is nationally reported through CMS, and what we have here is our scores for the 5 categories that are most important to us. We do have a 20% response rate, and our numbers are fairly high. From the CMS website, we had 994 surveys completed in the last 12 months, and we are rated as 3 stars. Our goal is to get to 4 stars. And you can see our scores as compared to national, which is the bottom line. And then in the middle is our scrubber. And a scrubber is software that scrubs our surveys that are most recent to see how we're trending. And we're trending as high as CMS right now, and we are trending to be at 4 stars next January. So the areas that are important to us are patients who choose us. We want a 9 or a 10. We want patients to recommend us. We want our patients to feel that we're professional and provide good care, and that we treat them with respect. So the survey is quite lengthy, and it is put out by CMS. We cannot revise it. It is the same for every home care program in this country. So more to come next month, but we are trending up, and I want to thank my staff in home care for providing exceptional service that is allowing us to improve our outcomes.
Awesome. Thank you, Tammy. Jermaine? COVID update. We don't have a doctor on here tonight, but I like to play a doctor, so I'll do this slide. The good news with COVID is we made it through the entire season with definitely some small outbreaks, but none of them resulted in any, significantly negative outcomes. Both our patients and our care members dealt with really, for the most part, what were cold-like symptoms. So we're not in any way experiencing the type of things that we did at the beginning of this. You could see that we've only had 1 case up through the 16th of April, which was at Terrence Cardinal Cook, and everyone else is at baseline. So this is really good news, and I think it's a testament to the great infection control practices that you folks are following within your various programs. Next slide, please. Jason was going to talk a little bit about the quality measures at the nursing homes. Jason?
Thanks, Scott. So as you know, these get updated each month. If you don't know, they definitely get updated each month. Our scores are based on a point system. They are primarily reported through our minimum data set, which comes from our nursing documentation. And then there are 9 measures that are based on billing claims. So claims data, which are data that are, readmission data, length of stay data that goes through the Medicare claims process. The goal for each center is to be 5-star in quality measures. When we are 5-star in quality measures, then we get an extra point towards our overall star rating. And you can see here, a lot of good work's been done. A lot of centers have moved their rating up to 5-star. At TCC, we had a long wait for them. They finally have a star rating now with this update that came out yesterday. So we'll reflect that on the next meeting. They have quality measures and a full star rating. They're not frozen anymore. So everybody has the opportunity now to go to 5-star in quality measures. Really important metric. When folks and consumers go look at this website, they go to staffing and quality. They really don't understand the rest of it, because annual health inspection and all those terms that go along with it doesn't resonate with folks looking at this site. But they definitely know what quality means, and they certainly understand staffing. So those are the places they look. So great job, and much appreciated, because this is very important to our success.
Thank you, Jason. Why don't we give something else away? Christine, pick another name.
All right, so the next name I have on my list, Christopher Asen.
And what does Christopher win?
He won another $50 Amazon gift card. Congratulations.
Way to go, Christopher. Next slide, Jermaine. As I said, we made some real progress on the hiring and staffing side across the entire system. I'm beginning to sense a little bit of a improvement in the labor market, and our ability to recruit staff is improving to some degree. But as a system, we've just been doing a great job with this, and Alyssa and the team that does the recruiting, kudos to them. And Jason, why don't you give a little update here?
Sure. So that the most important column on this, where it says total nursing hours per patient day, PPD, facility actual, right in the middle of the screen, and there's two pink cells showing 3.06 and 3.08. That column did not look like that a year ago. The numbers were much lower. We didn't have centers, moving past 3.0 hours per patient day. The goal is to get everybody to the column to the right, to 3.07, 3.2, to get to everyone to those numbers, because these numbers were based on the patient profile in the center, what the patients need in the center, and how many hours per patient day we believed were needed in each of the centers for us to be successful and have enough staff. So still a work in progress. Recruiting's been going strong. We've had great orientations every Monday, and then in every location on Tuesdays. But that middle column does look a lot different than last year. So, great work at keeping folks on board and not having turnover. That's a huge, important piece for those folks when they start the first 90 days on the job, is that we keep them and we can keep moving these numbers up together. So thank you. And here's the hires.
Yeah, go right ahead.
This shows you what I was speaking to. These are the hires year over year, March of 2023 versus March of 2024. And it gives you the percentage increase, how many more folks we hired this March compared to last March. You have the nurses and aides on the left, and then in the middle, we also throw in the nurse aide trainees that are entering our programs. So folks that are going to go through our course in our site, and then take a job, in our facility as a certified nursing assistant once they complete the course. So very good progress year over year. We like to measure same months out of the year when it comes to hire. And so compare on a 12-month basis or look back at a similar month, because there's a lot of seasonality in hire. December is much different than March. The summer is different than the winter. So we try to compare like months. And also we have to consider, do we have this many orientations in a given month? If it's a short month, we might not have as many, and some months might have more. These 2 months had 4 orientations. So great progress, and we'll keep pushing to get more staff into the buildings. And here's the terms. Again, very important, like I mentioned before on the PPD slide, this shows the trend of how many folks are terminating 2023 versus 2024. Clearly, the number has gone down. So everyone on this call and everyone in the sites has really pitched in to try to make people feel at home, make them want to work for Arch Care, and retain them so we can keep increasing those staffing numbers to where we'd like to be, and get everybody on the playing field we wanted to be on, and make sure we have enough folks to take care of our patients at the highest possible level. So great work on this.
Thank you, Jason. Chelsea?
All right, good evening, everyone. So we're thrilled that we have been certified as a great place to work for the second year in a row, system-wide. For those of you who may not have been here to do the survey, this is our tool that we use to analyze the employee experience. It's sent out every single year to all employees, and it assesses their experience on many different levels to see if we are meeting or exceeding your needs and where we need to put in a little bit more work. So we have increased our overall score 11 points since we started doing the survey back in 2019. And we met the threshold to become certified the last 2 years. So that's great news, and we're very proud of that, but that doesn't mean that the work is over. All of that feedback that we get from all of you, we put into action. We look at those results and we find the areas that need the most work. And throughout that whole next year, all of those needs are addressed. So every program will identify their specific needs and areas of improvement and put action plans together to address those needs. So right now, we are in that stage where those action plans are being created. Communication is being put out there throughout all of the programs about how the programs did, what are the biggest areas that will be focused on, some changes that will be made. And the next survey will be sent out early 2025. So you'll hear a lot more about this. And we're always encouraging you to participate. This is how we understand what your needs are and how we can become a greater and greater place to work.
Thanks, Chelsea. Christine, let's give away another gift card.
Sounds great. We have another $50 Amazon gift card, and the winner is Thomas Flores.
Oh,
Congratulations, Thomas.
I know Thomas. Nice. Congratulations. Next slide, please. We got some exciting things coming up. We'll run through these. Jason?
Thanks, Scott. So, Nurses Week, we will be sending out gifts that they should be arriving in the next couple weeks for all the centers. Every year we celebrate our nurses who are the backbone and ensure that our patients get all the care that they need and that they're happy, and we appreciate that. So we'll be sending out some gifts and have events for each of the programs during this week in May. Next one. And what used to be called Nursing Home Week, they changed the name twice. We've been doing this at least 20, 30 years for me. So typical Nursing Home Week, Skilled Nursing Home Week, I should say, where we'll celebrate everyone in the center that provides for our residents and our families as well, and appreciate everyone for the hard work that they do throughout each year.
Our next webinar is a family webinar, not a staff webinar, and that will be on May 15th. So appreciate everyone's help in promoting this with our families so that they have an opportunity to ask questions and get briefed on the latest news of our ministry. Next slide, Jermaine. Speaking of great place to work, we're going to take May 23rd, the Thursday before Memorial Day weekend, and it's going to be a celebration of our Great Place to Work certification. We're going to be hosting a barbecue for all the staff across the system at all of the programs. Each site or program are going to do things a little bit different. I think what won't be different is it's a barbecue. And we're going to have fun. So I look forward to seeing the creativity at the different sites and the way you folks choose to celebrate this. It's a red t-shirt day, and it's a great way to kick off the summer. So we look forward to that. Our annual White Mass, which is just a wonderful celebration with His Eminence Timothy Cardinal Dolan. It's an opportunity for us to celebrate Mass and recognize the work of our healthcare workers, professionals, and caregivers. And this is on June 6th, 10 a.m. at St. Patrick's Cathedral. Everyone is welcome. I know most of the sites that are in the outer areas, we have buses that go to pick them up. Calvary is going to be participating, and the bus is going to swing by to pick folks up at Calvary. And it is really a great time for everyone and an opportunity to meet His Eminence and hear his comments about the great work that you folks do. Why don't you give something else away, Christine?
Sounds good. All right, we got another $50 Amazon gift card going to Chantel Denus. Congratulations, Chantel.
Way to go, Chantel. Dwight Bolden just sent me a chat. He wants swag. I guess he'd rather have swag than a $50 gift card, but I get that, Dwight. Everybody wants to be rocking the Arch Care like Chelsea is tonight. And then we have the Puerto Rican Day Parade. This is an awesome outing. I've participated every year that we've done this. We all meet. We have float. Carlos Diaz helps to coordinate this. And then when we're done marching in the parade, we go over to Mary Manning Walsh to the outdoor patio, and we have a barbecue and a get together. It's really a fun day, and hopefully everyone will participate. And how to register is on the screen, and you'll be seeing it in the programs on the TVs and the lobbies and a variety of other places. But please come out and enjoy the day with us. Fortunately, every year we've had good weather so far, and we'll keep our fingers crossed that June 9th is another terrific day. Next slide, Jermaine. Does that mean that was the last slide?
Yes.
Yes.
Yes, this is the last
So,
slide.
Christine, why don't you give away another $50 gift card, and then we'll start answering some questions.
Sounds good. I love this job. All right. The last person to get a gift card today is Joanne Bannon. Congratulations, Joanne.
Awesome, Joanne. Enjoy. So our first question was specific to Ferncliff, and it had to do with some agency nurses, but I believe you spoke with the staff and addressed this, Jason?
Yes, yep. And HR followed up and we closed the loop, so we're good with that one, Scott.
Perfect, perfect. Let's see. There's a question here about the move from the Harlem Pace site to TCC. Glad you asked this question. You give me a chance to talk about the exciting development of our Pace Center that is going to be located in the first level of Terrence Cardinal Cook on the Madison Avenue side and the second floor of the Cohen Building, where we're going to be building a Pace Center that's going to have the capacity for twice the number of individuals our center does in Harlem. And the social day space is being built out as a typical town center that's going to have everything that you would find in Main Street of any town in USA. A movie theater, a floral shop, a coffee shop / diner, library, a whole host of things that when the participants come in, they're going to be able to go and do whatever activity they'd like to do, and I think it's going to provide a really enhanced quality experience for our PACE participants. And brand new space. The clinic's going to be able to serve significantly more individuals, and we hope to be moving there by July of 25, which is when our lease is up at the location we're currently at. So that's going to be very exciting, and we look forward to Derek and the team building our enrollment to fill that PACE site. There's a question about keeping the buildings a bit cooler. That's not an uncommon comment for April 24th. We get caught twice a year because of the age of our buildings. They have what's called a two-pipe system in them, and at the same time, there's either heat or air conditioning. You can't have both at the same time. So the weather, during April and early May, sometimes you can have some really hot days. Like next week, I think Monday or Tuesday, it's supposed to be 80 degrees. we don't have the ability to switch from one day to the next from heat and air conditioning. We switch to air conditioning in our buildings generally around May 12th or the 15th, depending on what's happening with the weather. And then in early October, we switch back to heat. So I can understand there are times it's a bit uncomfortable, and that there's not too much we could do about it, unfortunately. But make sure you're drinking lots of fluids if it's hot, and hopefully our management team is addressing those type of days where it's going to be hot in the building, and making sure we're doing everything we can to keep you as comfortable as possible, as well as the people we serve. When will the Quest contract be finalized? Does someone know what that's about?
Sure, that's for PACE. So first, I just want to thank everybody on the PACE team for being patient as we navigate that transition. As a lot of you probably recall, we got about a 2-day notice from Lenco that they were being acquired by Quest, and so needless to say, it was a rather haphazard transition, but we've been able to have a stopgap measure in place in the meantime, and we are very aggressively working with the Quest team in order to get that contract finalized so we can have a better protocol moving forward. So, I want to thank the contract team really for staying on top of that, and they're doing a lot in order to get that moving, but it's been a bit of a task. So thank you for your patience.
We have a comment about staffing, and without knowing what program or location you're referring to, it's hard for me to address that. But I think we're able to know who sent the chat. So we will reach out to you personally so that we could have a conversation about it and answer your questions. There's a question about Franklin Covey in-person training for 2024. Is there going to be additional in-person Franklin Covey trainings? I'm glad someone asked this question because we're so excited about our 2-year engagement with Franklin Covey and the opportunity to provide professional development and personal development through the various tools and courses that Chelsea and Stephen Covey's group are doing across all the programs. But Chelsea?
Sure. Yeah. We have sent out the dates for the leadership development program with Franklin Covey this year. It's focused on change and building trust. Lauren, I can send you those dates out if you don't have them. And then we'll be doing a similar program that we did last year, where there'll be an accompanying online program for individual contributors. So I'll get that information to you, Lauren. And if there's anybody else who is curious about this year's Franklin Covey program, you can reach out to me directly.
And I do not see any other questions. Do we have another gift card to give away, Christine?
Yes, we do. All right. Let me see here. How about? Oh. Let's see here. Sorry.
Building a lot of suspense.
Here we go. Nelson Oligario.
Oh, congratulations, Nelson. Awesome. So everyone look at 360 tomorrow, and the list of the winners will be there. I appreciate everyone's participation. I wish there were more questions, but that's all. Normally we have several pages. So I don't know whether this is indicative of the fact that we're doing a better job communicating at the program level, or people are tired and they don't have any questions, or they were just here for the information. But we're always available. You can always send a question to info@archcare.org, or reach out to us directly. We do want to be responsive and listening to what your concerns are here at ArchCare. So God bless everyone. Thank you. I hope everyone has a great week, and we will see you at our kickoff barbecue for the summer coming up. Thanks, everyone.
Thank you.